The manual muscle testing section of this video is meant to supplement your text by demonstrating the technique for testing the fingers and thumb. Please refer to the text for more detailed information about grading manual muscle tests and other specific considerations. The first muscle test we will demonstrate is for finger MP extension. The prime movers for MP extension are the extensor digitorum, the extensor indicus, and the extensor digiti minimi. To test the extensors against gravity, the patient's forearm is in a pronated position supported on the table. The patient's fingers are relaxed and the therapist supports the wrist in a neutral position, being sure it is stabilized throughout the test. Once in position, the therapist gives the following instructions. Lift this knuckle straight as far as it will go. Keep the rest of your fingers bent. Don't let me push you down. Using one finger, the therapist pushes the head of the proximal phalanx toward flexion. These steps are then repeated for each digit to be tested. To test the extensors with gravity eliminated, the patient's forearm is supported on the table in mid-position. Again, the fingers are relaxed in a flexed position, and the therapist stabilizes the wrist in neutral. Once in position, the therapist gives the following instructions. Try to move this knuckle back as far as it will go. Keep the rest of your fingers bent. While the patient attempts to move the MP joint into extension, the therapist palpates the muscle belly of the extensor digitorum, which is located on the dorsal ulnar surface of the proximal forearm. The extensor tendons can also be observed and palpated on the dorsum of the hand. Next, we will test finger IP extension. According to EMG evidence, the intrinsics, especially the lumbricals, are the primary extensors of the IP joints. While there is no reliably good test for lumbrical function, we will demonstrate the traditional test for the lumbricals. To perform the traditional lumbrical test, the patient's forearm is supported in supination with the wrist in neutral. The MP joints are extended and the IP joints are flexed. The therapist stabilizes the wrist and metacarpals. Once in position, the therapist demonstrates the movement to be performed and gives these instructions. Bend your knuckles and straighten your fingers at the same time. As the patient performs the motion, the therapist holds the tip of the finger being tested and pushes it toward the starting position. Now we will demonstrate the test for finger DIP flexion. The prime mover for finger DIP flexion is the flexor digitorum profundus, or FDP. To test the FDP against gravity, the patient's forearm is supported on the table in a supinated position with the wrist and fingers relaxed. The therapist firmly supports the middle phalanx of the finger to be tested to prevent flexion of the PIP joint. Once in position, the therapist gives the following instructions. Bend the last joint on your finger as far as you can. While the patient flexes the DIP joint, the therapist places one finger on the pad of the patient's finger and applies resistance toward extension. These steps are then repeated for each digit to be tested. To test the FDP in a gravity-eliminated position, the patient and therapist begin from the same start position, except for the patient's forearm, which is turned to mid-position. With gravity eliminated, the instructions are given and the patient attempts to flex the DIP joint. The therapist can then palpate the muscle belly of the FDP just volar to the ulna in the proximal forearm. The next test is for finger PIP flexion. The prime mover for PIP joint flexion is the flexor digitorum superficialis, or FDS. To test the FDS against gravity, the patient's forearm is supported on the table in a supinated position with the wrist and fingers relaxed. The therapist must hold all IP joints of the fingers that are not being tested in full extension. This is done to eliminate the influence of the FDP. Remember that in some people, the index FDP is such that this method will not rule out its influence on the PIP joint. If this is the case, it should be noted on your evaluation. Once in position, the therapist points to the PIP joint and gives the patient these instructions. Bend just this joint. Using one finger, the therapist applies resistance to the head of the middle phalanx in the direction of extension. To test the FDS with gravity eliminated, the patient and therapist begin from the same start position except for the patient's forearm, which is turned to mid-position. The instructions are given, and the patient attempts to flex the PIP joint. The therapist can palpate the FDS muscle belly on the volar surface of the proximal forearm toward the ulnar side. The FDS tendons can be palpated at the wrist between the palmaris longus and the flexor carpi ulnaris. The flexor digiti minimi, or FDM, is one of the prime movers for finger MP flexion and the only muscle whose sole action is MP flexion of the fifth digit. The FDM is tested using the same starting position as finger DIP and PIP flexion. As the patient flexes the small finger at the MP joint, the therapist gives resistance at the head of the proximal phalanx. The next test is for finger abduction. The prime movers for finger abduction are the four dorsal interossei and the abductor digiti minimi. The finger abductors are tested in a gravity-eliminated position only. To get into test position, the patient's forearm is pronated and supported with the wrist in neutral. The fingers are extended and adducted with the MP joints at slight or neutral flexion. Once in position, the therapist instructs the patient, "Spread your fingers apart and don't let me push them back together." Using the thumb and index finger, the therapist applies resistance at the radial or ulnar side of the proximal phalanx in an attempt to push the finger toward midline. Remember that normal finger adductors do not take much resistance. Refer to your textbook for further instructions on grading the abductors and adductors of the fingers. The first dorsal interossei can be palpated in the dorsal thumb web space. The abductor digiti minimi can be palpated on the ulnar border of the fifth metacarpal. The other interossei sit between the metacarpals on the dorsal aspect of the hand. The prime movers for finger adduction are the three volar interossei. They are also tested in a gravity-eliminated position. The start position for finger adduction is the same as for abduction, except that the fingers will start from an abducted position. The therapist holds the heads of the proximal phalanx of two adjoining fingers and applies resistance to pull the fingers apart. The palmar interossei are too deep to be palpated with certainty. Next, the test for thumb IP extension will be demonstrated. The prime mover for thumb IP extension is the extensor pollicis longus, or EPL. To test the EPL against gravity, the patient's forearm is supported in mid-position, with the wrist in 10 to 20 degrees of flexion. The MP and IP joints should be flexed. The therapist stabilizes the proximal phalanx while holding the MP joint in flexion. Once in position, the therapist gives these instructions. Straighten the end of your thumb. The therapist places one finger over the dorsum of the distal phalanx at the patient's thumbnail and pushes the DIP toward flexion. To test the EPL in a gravity-eliminated position, the patient and therapist begin from the same start position, except for the patient's forearm, which is supinated. When the patient attempts to extend the thumb IP joint, the tendon of the EPL can be palpated on the ulnar border of the anatomical snuff box, as well as on the dorsal surface of the proximal phalanx of the thumb. The prime movers for thumb MP extension are extensor pollicis brevis and extensor pollicis longus. The test for thumb MP extension uses the same start position as thumb IP extension. For this test, the therapist's index finger is placed on the dorsal surface of the head of the proximal phalanx, and resistance is given in the direction of flexion. Be sure the patient keeps the IP joint bent while performing MP extension. Next, we will discuss two muscle tests that can be performed to assess thumb abduction. The prime movers for thumb abduction are the abductor pollicis longus, APL, and abductor pollicis brevis, APB. To test the APB against gravity, the patient's forearm is supported in supination with the thumb adducted. The therapist stabilizes the wrist in neutral by supporting it on the dorsal and ulnar side. Once in position, instructions are given. Lift your thumb directly out of the palm of your hand. Don't let me push it back in. The therapist makes sure the patient is moving in palmar abduction and then gives resistance by pressing with one finger on the head of the first metacarpal in the direction of adduction. To test APB in a gravity-eliminated position, the patient and therapist begin from the same start position, except for the patient's forearm, which is turned to mid-position. When the patient moves the thumb into palmar abduction, the therapist can palpate the abductor pollicis brevis muscle belly over the center of the thenar eminence. The test for the abductor pollicis longus is very similar to that of the APB. The one difference is that the patient must abduct the thumb halfway between thumb extension and palmar abduction. Next, we will demonstrate the test for thumb MP flexion. The prime movers for thumb MP flexion are the flexor pollicis brevis, FPB, and the flexor pollicis longus, FPL. To test the FPB against gravity, the patient's elbow is flexed and supported on the table with the forearm in supination greater than 90 degrees. The palmar surface of the thumb should face the ceiling and the MP and IP joints should be extended. The therapist firmly supports the first metacarpal. Once in position, the instructions are given. Bend your thumb across your palm, keeping the end joint of your thumb straight. Don't let me pull it back out. The therapist offers resistance at the head of the proximal phalanx in the direction of extension as the patient attempts to flex the MP joint. To test the FPB in a gravity-eliminated position, the patient and therapist begin from the same start position, except for the patient's forearm, which is supported on the table in supination, so the thumb can flex across the palm. After hearing the instructions, the patient attempts to flex the thumb at the MP joint. The therapist can palpate the FPB on the thenar eminence just proximal to the MP joint and medial to the APB. The prime mover in thumb IP flexion is the flexor pollicis longus, or FPL. The start position for this test is the same as that demonstrated for thumb MP flexion. The therapist then stabilizes the proximal phalanx and resists the distal phalanx as the patient bends the IP joint. Our next test will assess thumb adduction. The prime mover for thumb adduction is the Inductor Pollicis muscle. To test the Inductor Pollicis against gravity, the patient is positioned with the forearm pronated, wrist and fingers neutral, and the thumb abducted. The MP and IP joints are extended. The therapist stabilizes the metacarpals of the fingers, being sure to keep the MP joints in neutral. Once in position, the therapist gives these instructions. Lift your thumb into the palm of your hand and don't let me pull it out. While the patient adducts the thumb, the therapist grasps the head of the proximal phalanx and tries to pull it away from the palm. To test the Inductor Pollicis with gravity eliminated, the patient and therapist begin from the same start position, except for the patient's forearm, which is supported in mid-position. Our final test will assess opposition. The prime movers for opposition are the opponens pollicis and the opponens digiti minimi. To test opposition against gravity, the patient's forearm is supported in supination, with the thumb adducted and extended. The therapist holds the wrist in a neutral position using both hands. This will place the therapist in correct position to resist both the opponens pollicis and the opponens digiti minimi during the test. Once in position, the therapist gives these instructions. Touch the pad of your thumb to the pad of your little finger. Don't let me pull them apart. As the patient opposes the thumb and small finger, the therapist holds one hand along the first metacarpal and derotates the thumb, and the other hand along the fifth metacarpal and derotates the little finger. By using both hands, the muscles are resisted simultaneously. To test opposition with gravity eliminated, the patient and therapist begin from the same start position, except that the patient's elbow rests on the table with the forearm perpendicular to the table. Instructions are given, and the patient attempts to oppose the thumb and small finger. The opponens digiti minimi can be palpated volarly along the shaft of the fifth metacarpal. The therapist can palpate the opponens pollicis by placing the fingertips along the lateral side of the shaft of the first metacarpal. The manual muscle testing portion of this video is now complete. Please refer to the text for a more detailed review of all the manual muscle tests. Remember that proper technique takes practice.